All right. Well, before the talk, I always like to acknowledge people who inspire us. In this case, Su Qian, who was really seminal in terms of merging engineering and medicine and towards the new generation of investigators. And that journey was made possible by my other mentor, Linda Dimmer, who pushed my career and to collaborate with engineers in Caltech and engineering school. And over the time, people like Bill Burke, as well as Don Heistad, I'm sure Martin, knows him very well. But lastly, this journey has been continued because of Jiaping Wang and Jinliang Ma for these opportunities. So I'd like to talk about metabolic disorders as well, but in a different aspect. If you look at this 54-year-old versus 92-year-old, well, we're seeing patients who are becoming healthier and they live longer. But this person who has a blood pressure 139/82 was this 92-year-old gentleman who has a blood pressure 135/65. Why is that? Well, obviously, metabolic disorder and changing in vascular compliance and leading to vascular fibrosis. And over time, as you know, we have increasing pulse pressure. And therefore, that increase in pulse pressure gave rise to vascular fibrosis and hypertension. We heard so much about metabolic associated steatotic fatty disease, so I don't need to say anything more. Yet this is really an unmet clinical challenge. It is a silent disease, and this is a driving force where we need to work together as a team and to address this rising pandemic. With this rising pandemic is also the increasing population who are agents, and how do we help our patients who can age gracefully with dignity? Well, we heard from the open ceremony as well as other leaders that heart failure is no longer the #1 killer. Well, because you guys have done an incredible job to modify the cardiometabolic risk factors. However, can we modify chronological agents? Well, the answer is perhaps we could work together towards that directions. And with the emerging imaging and data science as well as sensor, hopefully we can make that possible. So instead of, you might have chronological aging, yet you could have healthy organ undergoing graceful aging process. Well, so this process is made possible by, supported by National Institute of Bioengineering and Imaging Society, NHLBI, as well as American Heart Association Center grants. And together, we're very lucky to integrate with UCLA as well as Caltech. So 3 schools and 3 institutes in collaboration with industry. And so our goal is to train the next generation of physician scientists as well as biomedical engineers who can be nimble between engineering and medicine to solve these emerging issues. So I'd like to share with you how we try to move on this humble journey. And so we like to start with this team approach, where I would like to address first how we use sensor and followed by imaging to address cardiometabolic disease. And meanwhile, we'll be interfacing with AI machine learning and to perform data processing as well as to predict the final outcomes. So this was made possible by this multidisciplinary approach to reduce metabolic disparities. And as you know, the socioeconomic disorder or socioeconomic disadvantaged population, both in this country as well as in the US, are the ones who are more prone to cardiometabolic disorders. And so together with Caltech, UCLA Health, and UCLA School of Medicine, our goal is to really integrate engineering, medicine, and industry to train the next generation who could be entrepreneur and who could be problem solvers. And this requires connecting dots. And so we're connecting multiple dots across campuses and across institutes. Even when Yibing Wen was at UCLA, his lab was next to ours. We are connecting with cardiomyopathy investigators, but also we are connecting with other centers as well as T30 training programs in the hope to train the next pipelines of people who can be limbo between engineering and medicine. So these are the trainees who are from different backgrounds. They can be biological scientists or engineers, or somebody could be in medicine. And the idea is that we can work together and to solve these challenging problems. And our faculties are enlisted from, likewise, engineering, physical scientists, and biomedical research institute to work together. So therefore, let me share with you how we can conquer one problem using sensor. So we heard so much from Gabriel about your insightful story about fatty liver disease. And so it's a silent disease without further introduction. Then the idea is can we detect or demonstrate early detections for people who are otherwise not able to receive preventive care in this country. Right. So you talk about cardiac biopsy, and I think liver biopsy remains the gold standard, or one can use ultrasound or DAXI, bioimpedance, as well as MRI or CT scan, and to predict or to demonstrate potential conversion and to fatty liver disease. Well, our goal is to whether we can demonstrate a wearable device that will be low cost and low energy consumption, and which is wearable, and to demonstrate this possibility. So that requires a team approach, right? So traditionally, people will be pursuing an MRI study as a gold standard or non-invasive standard to predict conversion of fatty liver disease. And so therefore, we decide to address this from electrical engineering standpoint, how we can use electrical impedance to reconstruct the liver profile, therefore changing lymphatic profiles. But that idea can be possible by demonstrating a liver belt, a belt that could really address changing in liver impedance. And obviously, this idea was promoted by a team approach, right? There are people from engineering, human genetics, human nutrition, as well as data science. And so this idea can be, oops, I think there's a mistake right here. Why is this? For some reason, the slide was truncated. Just bear with me. All right. So the idea is that when we assess fatty liver disease, requires data acquisition. So the cartoon on the right upper panel demonstrating a person wearing a belt, and that belt will provide electrical signals, and the data will then be processed by realizing patients' BMI or body contour. And together, one can predict the electrical mapping of the liver profile at the two-dimensional stages. But this stages is nowhere close to MRI study. Therefore, the machine learning here, the cycle game, is a very unique approach and to address boundary conditions necessary to reconstruct the liver impedance. And this results in a data to the right corner, although nowhere to the level of an MRI, but then MRI data is also based on proton density. So when there's presence of fats that change the electrical conduction, that can be measured in terms of proton density by MRI. And whereas electrical impedance and the presence of fat could change the resistance of the liver profile. And so that changing resistant profile can then be reconstructed into three-dimensional imaging shown on the right-hand side. So that idea allows us to perform preclinical study, recruiting patients with BMI. And Gabriel, we used BMI over 30. I saw your data over 35. And then, of course, it's a small study, but just to demonstrate the concept that this idea could really potentially be useful to predict small changes in fatty liver content. And so we only talk about perhaps metabolic associated steatotic fatty liver disease, but we're not talking about progression towards hepatitis or cirrhosis. But the goal is to really perform early screening to our socially, economically disadvantaged populations. And we can see the correlations. So that's one idea where team science become possible. And the other one idea is, well, perhaps this is well known to cardiologists, and everybody is looking for a wireless and leadless pacemaker. And I know Hussein at your institution, John Roger, demonstrated the smallest micro pacemaker. But then we ask next question, and our MSTP student asked next question is, well, can we have a leadless pacemaker that could help to restore electrical conduction or help to pace the heart if necessary without batteries, right? So that idea became possible by developing this small, tiny micro pacer that can be cannulated through the arteries into the anterior cardiac vein. The idea is not to perform open heart surgery or not to generate a pocket to the upper subclavian area for implantation. And ultimately, the idea is to avoid leads, to avoid batteries, right? So I can bypass the electrical engineering part, but just to impress you, the sensor is analogous to, this is your finger, so that's how small the micro pacer can be. And so that idea is become possible, demonstrated by this pig model, and where the micro pacer could be implanted to the anterior vein. And these are the data showing energy transfer and energy acquisition to the micro pacer. So that's the idea of demonstrating in the pig model. So this idea, then one can press this electrical pad over the surface of the pig model, and so that one can generate electrical signal to restore conduction. So one can measure pulse wave profile to the femoral arteries, or one can measure velocity profile, as well as other electrical signals. So this idea, once again, is the team science approach where we collaborate with cardiologists and electrical engineer, as well as talented students who make this kind of team science possible. All right, and then we also heard about wearable sensor at the open ceremony, where people talk about AI machine learning. Wearable sensor for remote sensing is equally remarkable. You know about Apple Watch, but then the strength for this type of wearable sensor is cardiometabolic monitoring. So, right? Can we monitor biomarker, maybe one day endorphin for patients with cardiac fibrosis, right? So this kind of biomarker can then be possible to perform markers such as insulin, branched chain amino acid, or even electrolyte over time. Right? Well, this is still at the experimental stage, but then this idea is not possible. And guess how do you acquire this data without blood draw? So the idea is that one can induce sweat from the surface. And so that we know that there's a correlation between electrolytes and some metabolites and serum electrolyte and metabolite. So in so doing, one can actually measure glucose and some other metabolite without blood draw. So I think that's really the novelty for the next generation of biosensors. Right? So this type of idea is now possible, and to perform continuous monitoring and to measure branched chain amino acid, for example. And the idea is to allow this type of sensor to be seamlessly comfortable, and so that this can be worn analogous to a Xyl patch. Right, over time, but then they are smaller, less bulky, and hopefully this type of idea can one day be possible to to really monitor our patients. So with that, I'd like to go to imaging. Another interesting part for addressing patients' population, but the challenge about imaging is light penetrations, right? So this diagram illustrates where the light penetration is limited to 1 millimeters. So when you use 2-photon microscopy or light sheet or any other imaging technique, you have to perform 3D reconstruction because the light cannot penetrate through the entire specimens. So the idea of this issue and it's called, so far we're still at the stage of microscopy or ballistic region, but then we like to push beyond that so light can penetrate through skin into the tissues of interest. So this is the idea of light sheet microscopy that was theoretically invented a century ago, yet with the modernization of camera, CMOS imaging, now we can acquire this data and we can acquire 2,000 images over 1 second. Right? So this is the idea of optical bench. I'm going to skip this part just to demonstrate the idea of laser light that can be penetrating into the tissue, and then the signal can be acquired by a very high frame rate cameras. Okay, so this is the idea where this could be, say, a zebrafish embryo. So one can use these laser sheets to rapidly scanning through these objects and generating multiple images. And so that these images allow us to reconstruct the hearts into a three-dimensional structure. And this type of structure can then be visualized such as zebrafish valvular structure undergoing dynamic closure and opening, or even structure like neuromuscular junction that can be realized by this type of imaging processing plus super resolution, including fetal mouse hearts and with the muscle bundles. All right, so the idea is to continue to push the boundary. And so now, in 2016, we were able to generate a dynamic zebrafish model. And 2022, when 2022, we were able to demonstrate a three-dimensional cardiac contraction coupled with intravascular blood flow. And so let me just replay this image again. So you can appreciate a dynamic system. So you can, so it is a contraction, cardiac contraction, and in the presence of intracardiac red blood cells. So the stages now continue to push the frontier for kilohertz and for deeper penetrations. And the work has also been featured by NIBIB, NIH website. So the student is performing a next stage of light penetration known as photoacoustics. So this is the idea where now you can have ultra-fast imaging, so one can assess the neurotransmitter or ionic conduction through the nerve bundle, as shown right here. So this type of images then can be possible using a photoacoustic and kilohertz imaging. And the invention of photoacoustic imaging by our collaborator at Caltech. So now one can combine ultrasound and heat wave, and together this will allow us to have even deeper penetration and beyond 1 millimeters. So let me share with you what type of clinical translation can be possible. So this type of clinical translation can then be possible to visualize dynamic changes of blood flow through the skin and into the superficial vasculature. And so this was perhaps the first demonstration of photoacoustic imaging using single element detector. And the one transducer can generate 6,400 images per second. Just another example where this type of images could be possible to address diabetic foot or diabetic disease and without an invasive procedure. Right? Okay. And finally, quantum imaging. The idea is to provide more light, to demonstrate more light, so that one can have better images. So I can show you differences between classical imaging versus quantum imaging induced resolution. Right? And so this type of resolution allows for fundamental studies such as zebrafish and cardiomorphogenesis, and the data is really providing a new dimension of metabolic information. So using photoacoustic, not only can one demonstrate live images, but one can acquire oxygenation as well. Well, if you're interested, I'll be happy to share with you the technique. But in the interest of time, I'm going to finalize our study as to how we combine sensing and imaging to address cardiometabolic disease, right? So we talk about, Gabriel also talked about patient recruitments. Well, it's very challenging to, I think in this room, the holy grail is to translate your clinical data to clinical trials. Yeah, clinical trial is very challenging, and Suma can share with that, and because the attitudinal barriers. And so we're very lucky to be supported by American Heart Association. This is a network center, and where our team is in collaboration with University of Hawaii, addressing Pacific Islanders, and then also University of Washington, dealing with Native Americans. And there are 4 other centers from Stanford, USC, UPenn, and Johns Hopkins. So the idea is how we can improve our clinical trial to overcome clinical barriers so that clinical trial can then be possible and be conducted to patients who otherwise distrust the governments. You all heard about syphilis experiments, and you all heard about women fertilization to the Native Americans. So this type of historical mistrust has impacted on our ability to really generate clinical trials that can be applicable for personalized medicine. So therefore, the idea of this idea is to really, can we address this for personalized medicine? And so that the goal is to overcome attitudinal barrier. So we're also training our fellows, and so that when they generate their medical devices, we like to make sure those devices are really can be personalized to individual. You probably read about study as traditional approaches we are using for measuring oxygenation in the hospital, yet we never design any devices to address people with high pigmentation that could impact it on the data, right? So therefore, the idea is then we actually used to perform a study in collaboration with our human nutrition, where we have 1,000 patients undergoing a clinical trial. In this case, very simple clinical trial, avocado study. And the idea is that whether if you consume avocado for 8 weeks, and they'd like to know about your cholesterol profile, your cardiometabolic profile, as well as your metabolic, as well as microbiotas, right? And so this idea requires data collections and machine learning to, to classify the data and then perform regression analysis for prediction. So the idea is that can we input the microbiota data, clinical biomarker, as well as patient demographics and social determinants of health, right? And those data can then be input and to predict individuals who might be responsive to nutrition. And obvious. So the study, I didn't have time to finish the data yet, but I can share with you that there is a bias, right? So the initial data demonstrated that only the white Caucasians are responsive to avocado study. So at the end of the study, their cholesterol profile can be improved. Whereas all others and patient population, in this case, we discover that Latino populations in this cohort will have higher prevalence for liver metabolic disease. And this, therefore, implicating the need to really train our next generation and to really incorporate social determinants of health and in our patient care. Right? So to summarize, I'm sharing you a patient who's 54 years old or 52 years old versus a 92-year-old patient. And so our goal is to whether we can mitigate their cardiometabolic disorder and so that they can be aged gracefully with dignity. And that process requires more understanding of cardiometabolic disorders and to identify therapeutic targets. So with that, I'd like to share our gratitude to people who work together as a team. And for us, we're very lucky to have a new leadership who believes in working together as a team. Even when it's really a game changer right now, we do work together as a team. And that team concept is really incredible. And I'd like to finish by, again, acknowledge the people who organized this meeting, and Dr. Wang, and Mark, and Yui, and as well as Hung and other leaders. And I was very lucky to meet with the uprising physician scientists in this country, as well as people who were given awards last week. I mean, yesterday. So our job is really to teach our next generation to work together and to elevate their career to mitigate cardiometabolic disorders. So thank you so much.